This was a young boy. He came to me when he was around 20-year-old. So he was shifted to the hospital in a completely unconscious and comatose stage. We injured his brain, so he was completely unconscious. He was on the ventilator. He had fractured ribs on both sides, for which both sided tubes were put in and ICDs were put in. He had multiple fractured bones, so the fractured clavicular spine was blown out, fractured at multiple places, and he was not moving hands or legs. They shifted him to the setup saying that he's not going to survive. Don't even bother to do anything. So this particular patient went through large amount of surgeries, a spine fixator for him, and repaired his spine when he went home. He has now completed his graduation. He writes sports blogs. After he went home, sometimes he has acted in a Tamil film, how well he has recovered. So that is
the story from a deathbed to a successful life.
Yes,
I think
so absolutely unbelievable with his family. 6 months of struggle.
Health checkups in your 30s, luxury or a necessity?
A necessity based on the risk factor which you're having.
Youngest patient with a heart attack that we have seen?
19-year-old, was a young male. He was a vegetarian.
Oh my God, okay.
Non-smoker and non-alcoholic, but had a family history of some cardiovascular disease.
So strong is the importance
and
of
stress.
a family history.
So I would say cardiovascular complications are increasing. Stress-related complications are increasing. More and more they are consuming various mixtures of alcohols, various mixtures of smokes. They are consuming so-called westernized drugs like cocaine, marijuana. We're getting a lot of these as well.
We used to think of the ICU as a place for the old, the fragile, the already ill. But today, a new, unsettling reality stares at our face. The young, once deemed invincible, are finding themselves critically ill and fighting for lives within our most advanced ICU setups. In today's episode, we dwell into this growing healthcare crisis that's redefining the landscape of critical care in India. ICU admissions, young adults battling for their lives due to lifestyle conditions, infections, and unexpected complications. Joining us today is a distinguished leader of critical care, Dr. Pradeep D'Costa. With over 2 decades of experience, he has not only been a lifeline for those thousands of patients who were critically ill, but has also reshaped the policies of critical care in India. Dr. D'Costa, the lead author of the landmark textbook Critical Care Ultrasound and Clinical Application, a proud recipient of prestigious Shaurya Puraskar for his exemplary service during COVID-19 crisis. He established India's first international training unit, which is ITU, as a point of care ultrasound in collaboration with WinFocus and serves as its local coordinator. And that's not that, a recognized educator. For most postgraduate courses in critical care, Dr. D'Costa was instrumental in setting up essential protocols during the pandemic. He is also among the very few Indian doctors who is trained in BSL-3, which is Biosafety Level 3 protocols by CDC Atlanta, which is a testament to his commitment to preparedness and precision. Hello and welcome to another episode of Sahyadri Health Talks. I'm Dr. Tushita. And today we have with us Dr. Pradeep D'Costa, sir. Sir, how are you?
Hi, I'm good.
How does it feel to be on this podcast?
Thank you so much for calling me on this wonderful show. And it feels great to be here in the rains in Pune. Thank you so much.
Thank you so much for giving us this time today, sir. And, as we already discussed, that today we are going to talk about ICU admissions in young adults, which is something which we are seeing quite frequently. So before I, dwell into that, just wanted to ask you, 2 decades of experience into critical care, right? How has this journey been for you?
The journey has been good. There is a lot said about critical care ills, but I would prefer to choose the positives. Indian critical care is very, very rewarding and fulfilling. So at the end of the day, life saved is what counts. And I think that's the take home message. Saving lives in resource limited settings is one of the most rewarding aspects in my career till now.
So, what keeps you going?
The adrenaline of saving lives, the adrenaline of saving people, and the adrenaline and the joy of seeing someone who has come back from the dead and who greets you and who starts working and who enters society is something which you feel really good about.
So, sir, as we see in the last couple of years, and maybe in last one decade, we are seeing this gradual shift of this particular age group of patients coming to critical care. So, what's happening? It's typically between 20s to maybe early 30, late 30s or something like that. So, what's this gradual shift all about, and why is it happening?
That's a very truth, and we have a age of Indians. I would say less than 45 is now the new age where we are facing multiple complications.
Oh,
And it's a variety of factors which is leading to this, right from lifestyle to stress to pollutants. There are a whole number of factors which I think are contributing to this new, I would say, epidemic
yes.
of young people coming into the ICUs. And the sad part is that many times, like in the previous generations, the young children used to get their parents to the hospital.
Yes.
We are finding a reverse trend, which is
Reverse.
the
Parents
parents are
bringing kids.
getting their children to hospital some of the times for various ailments. I think that is concerning, and everyone has to keep note of this particular fact.
So when you talk about, you just said the various ailments, right? So what incidences are more? Heart attack, strokes, drug overdose? What are we seeing more?
True. So I would gather all these ailments under one cardiovascular group. And in this group, heart attacks, not only heart attacks and strokes, remember blood clots in various organs like lungs, which is called pulmonary embolism. We are getting pulmonary embolisms in a big way. We are getting clots in the stomach area, which is abdominal thrombosis in a big way. We are even getting clots in the brain, which is called cortical venous thrombosis in a big way, in addition to the strokes, in addition to the heart attacks which are being faced. So I would say cardiovascular complications are increasing. Stress related complications are increasing. More and more young people are consuming more and more substances for recreational use, for
So when you
peer
say
pressure use.
substances, I mean, what are we talking about here?
Yes, we are getting more and more urbanized. As we get more and more urbanized, people are tending to experiment more and more. And as they experiment more and more, they are consuming various mixtures of alcohols, various mixtures of smokes. They are consuming so-called westernized drugs like cocaine. We are getting a lot of these as well. Cocaine, marijuana. We are getting a lot of these as well.
Achha.
And a mixture of all of these also as
Oh
well.
my God. Okay.
An underdiagnosed substance which is consumed in a big way is gutka. There is no
Gutka.
mention of gutka in any of the Western literature.
Yes.
But this form of tobacco is one of the most dangerous risk factors, I would say,
Oh
in
my
the
God.
Indian subpopulation.
We thought it's only limited to, oral cancers and all that stuff.
Gutka can cause cardiac issues.
Oh my
Gutka can
God.
cause malignancies. Gutka can affect any organ in the body, which is unknown. It contains lots of carcinogens, which are not known to many people. And hence, I would say gutka eating is one of the major risk factors in the Indian subpopulation.
So, sir, as we spoke about this cardiovascular issues and this habits and all that stuff, apart from these, do you also feel that these are also a post-COVID fallout? Is it related?
Well, there have been lots of discussions about whether the vaccination of COVID has
because
led
there
to
was
increased cardiovascular events.
There was a series of WhatsApp forwards and all that coming up that you have vaccinated yourselves now. Be ready for the next level of complications. So
I think this is more of a myth.
Acha.
Because remember, the vaccination has helped us prevent a large
Survive.
number of COVID cases, and we survived out of that.
Yes.
The vaccine is a myth, and thrombotic complications are known after all vaccines a bit, very small number, not only COVID vaccines. So vaccine, I think, is just a very minuscule number of the percentage of complications of these cardiovascular. Stress, diet, lifestyle, food intake, risk factors. These are the major risk
major
factors.
issues. Yeah. So as you mentioned, stress. What percentage of patients do you see, or how many patients do you see who land up because of the stress being a factor?
It's difficult to compute an exact percentage of these particular persons, and stress would be overt stress in which the person himself tells you that there is some stress in his life, or some subconscious stress in which there is a stress in his professional discretion or his professional attitude or his professional work, which is causing a subconscious stress, like irregular duty hours, stress at the job place, where there are more and more targets being set and
Constant
more strict
competitions.
targets being
Yeah.
set, and cutthroat competition, you can say,
Yes.
which is leading to a large amount of stress, sleepless
Correct.
nights, and complications therefrom. From this, they tend to consume so-called addiction seeking drugs to calm themselves, which leads to more complications.
So do you see mental breakdowns also?
Yes, mental breakdowns are very, very common.
And
For-
in this young adult group?
Yes, young adult group mental breakdowns are reasonably common,
Acha.
more common than we think it is.
Okay, what does a mental breakdown actually looks like? Because many of us just believe that you cry out loud and that's a mental breakdown. But
the
explain this
personal
for us.
opinion is, if you cry out loud, you release your energies and
Yeah.
you release your mental stress, and that's
Correct.
a good way of releasing your mental pressures.
True.
A person who doesn't cry out loud, who stops communicating with people, stops talking to people, becomes irritable at the workplace, starts back answering, does not communicate regarding basic issues he's experiencing at the workplace. These are the warning signs I think we should watch out for. If we don't watch out these warning signs in advance, we could land up in major complications later on.
So you see this, as you were saying, that you see this mental breakdowns.
Yes, if you ask
landing up into ICU?
Well, not immediately.
Acha.
There are subtle signs, and if you don't look at these subtle signs and tackle them or counsel these persons at that particular point of time, they could end up in ICU with major complications. There are warning signs. If you tackle the warning signs in time, you can save a major disaster which is just impending.
Just tell us a few warning signs, maybe.
The lack of sleep,
Acha.
lack of exercise, not communicating, excess irritability with the family members, with the friends, less social connect. So the person sometimes stops going out with the friends, or excessive social connect.
Acha.
He
Which is
starts
again
going
bad.
out, consuming excessive stuff, addictive stuff. These are also signs that there is some mental stress which is leading to it.
So, sir, we have always thought when it comes to the health checkups, will any form of health checkup help prevent such ICU admissions?
Well, I suppose yes, to some extent. Preventive health checkups do help you to risk stratify and to diagnose the conditions well in time. And particularly in the young age group, I think they tend to neglect the symptoms most commonly.
Yeah, because most of us, we just feel that, we are too young for that.
Too young for that, and things will just pass off.
Yeah,
Maybe I take a crocin, pop a crocin, someone tells you drink cold milk, things like that, and people feel it will settle down. But you require to take a lot of care, particularly if in one of the risk factors, or you have a strong family history of some associated condition like cardiovascular or neural or anything.
So what age group do you suggest one should start getting an annual health checkup done?
The age group would depend on the risk factors, the family risk factors, and the history of, if he has any previous episodes of such cardiovascular or brain or leg or any other complication which he or she has experienced in the past. These people should definitely go for some cardiovascular and preventive health checkup, or they are experiencing any untoward symptom.
Achha.
I think this untoward symptom is important. It means symptoms which they cannot explain properly.
Okay.
For example, if the person is complaining of acidity and is not getting settled by basic medicines, by basic tablets, he should seek to investigate. We have had so many people who have complained of acidity, neglected it, and maybe brought with a massive heart attack or even brought dead sometimes. This is a very worrying fact.
So, sir, one more very important part of your day-to-day life is patient counseling. Right? How difficult is it when you do a patient counseling for, suppose, a young man around 28, 30 years old who has landed up in ICU? how do you manage and how do you tackle such
That's an
situations?
excellent point, and I must tell you that counseling these patients is very difficult. First of all, you have to deal with the sense of disbelief,
That this
and
has
that this has
happened.
happened to me, and acceptance that such a thing can happen to me. And remember, most of these people are the bread earners of the family.
True.
So, in addition to counseling them about the lifestyle, we have to keep a watch on how they can carry out their work. We cannot tell them to stop their work. We have to counsel with a point, carry out the work within a limited framework. And the counseling would involve, most important, counseling does not involve only the patient.
Acha.
The counseling involves the family members and the parents as well. So I think
most
this is an
difficult
important point
ones.
of the counseling. Family members, parents, children, all of them required counseling and are counseled by various people during the course of their stay in the ICU. They are also counseled about the stress and how to manage the stress properly. I think that's an important aspect of counseling. Plus, good food intake, good healthy food intake, good adequate proper exercise. I think these are important points in the counseling of such patients in the future.
So, sir, we will quickly move to the next section of this podcast. I'll just read out a few pointers. Let me know with one word answers if you can. ICU in one word.
Motivating, fulfilling.
Okay. What does a burnout feels like?
Zombie and overdrive.
That's beautiful
So
description.
it is that.
So burnout
because
happens very
you feel-
frequently. Do you see in your team burnouts?
if you manage the stress part reasonably by holding a good amount of stress management techniques, workshops, hobbies, encourage them to do their hobbies.
Yeah, I actually wanted to ask you,
So-
how do you keep your own team motivated in such a tensed situation? How do you keep your own team, yourself
Well,
motivated?
whenever there is a good success, we celebrate,
Acha.
and the whole team gets credited to a simple thing like a vada pav and tea or samosa and tea,
That's lovely.
and they all are called into a room and get positive words that they are done excellently, but we require to go forward the next time. This keeps up the motivation in a big way. Even if there is a mishap or we do not have the required endpoint, still we know that we have tried our best, and then counseling them, because many of them feel bad when we lose a lung patient. It's an important point to keep the team also positively updated.
Because over
so
a
that
period
it
of time,
keep-
I feel we also get attached to the
Yes.
patient, right?
that emotional attachment does happen, and you feel bad when you lose a young person in the prime of the life. But at the same time, when you know you've tried your best, it is just destiny, and some things are then accepted easier when you accept that it is just destiny.
Okay. Most ignored symptoms in young adults, which lands them
Well-
up in ICU.
Well, I would say kasatari hotoy.
Okay.
Kasatari hotoy is a symptom
Okay.
which I'm sure most people who are listening to this will agree to and relate to.
Okay. Translate that into Hindi for our Hindi audience.
Something is happening, kuch to ho raha
कुछ
hai.
तो हो रहा है. अच्छा.
They can't explain what is happening. If you ask them, some people say maybe indigestion. Some people young, they are unable to explain breathing problems. So they say kuch to ho raha hai. If the people is having an impending stroke, kuch to ho raha hai.
कुछ तो हो रहा है.
They can't explain chest pain, kuch to ho raha hai.
So कितने देर तक इस कुछ तो हो रहा है को
कुछ तो हो रहा है आता है पहले. कभी कभी तो लोग बोलते हैं अरे ये तो कुछ नहीं, ड्रामा कर रहा है, भेज देते घर पे. सेकंड डे आता है, ईसीजी निकालते हैं, हार्ट अटैक.
Oh my God.
So it is कुछ तो हो रहा है, should be
Giving me
taken very
goosebumps.
seriously. Should be taken very seriously.
अच्छा.
The second thing, acidity. मला ऍसिडिटी होतोय. काय केलंय? इनो खाल्लंय. कमी झालंय का? नाही कमी झालंय. फिर नेक्स्ट डे पे ऍसिडिटी होत आहे, परत आता है. नहीं ओमेज घेतलेलं, ओमेज टैबलेट घेतलेलं आहे. कुछ नहीं होता है, ले लो ओमेज जाओ. थर्ड डे हार्ट अटैक.
Oh my God. So heart is giving you signs.
It's giving you signs which
And
you
you're
should
not
pick up.
listening.
You should pick up. You should act on the signs. So कुछ कसं तरी होते and acidity in all patients, in my opinion, should be taken very seriously
अच्छा.
and given a full appropriate investigations.
अच्छा. Okay. One test every young adult should do,
Well,
irrespective of the risk factors.
yes. So I would say sugar and an ECG. These two tests, because we are facing a huge spurt in the number of diabetic
Diabetic
patients
patients.
and sugar related complications.
Mhm.
And India is one of the leading countries now in
When it
the
comes to
burden of
diabetes.
diabetes. And diabetes related complications are very high, and young diabetics are on the high.
Mhm.
In Indians, however, we have lean diabetics. Diabetics otherwise are classically obese,
Obese.
fat.
Yeah, because we talk a
In-
lot about weight management in
in
diabetes.
Indian, we have lean diabetics, which is the classical part of Indian subpopulation.
I think I have 2 at home.
Well, they should be taken care of very well.
Yes. Okay. Mental breakdowns can cause physical organ damage. Myth or a fact?
True, fact. The result is that because of mental related problems, it can release a lot of hormones, stress hormones, and it can affect many of the organs in some way or the other. So it is a fact. Mental health does directly or indirectly lead to problems. And mental health, I'm sure you must have heard there's a lot of stress on mental health these days. Mental health is one of the important parts of the counseling and the treatment protocols of many patients. It's an abstract, but mental health is very, very important.
Okay.
You have to make the mind very strong before you can be physically fit as well.
Yes, because a lot of physical conditions are won by a strong willpower and the
Yes.
mental peace which we have. Okay, moving on. Sleep is more important than supplements. Myths or fact?
Sleep is important. Good food intake is important
Acha.
more than good supplements.
Acha.
Good food, healthy food is important. And sleep, good food, and appropriate exercise, I think, are a good combination.
This trio is the
It's
best
a good combination to have.
Yeah. Okay. Health checkups in your 30s. Luxury or a necessity?
A necessity based on the risk factor which you're having. And if you have a strong family history, if you have symptoms, if you have an extremely stressful lifestyle, you definitely should go for some sort of a health checkup.
Youngest patient with a heart attack that you have seen?
19-year-old.
Oh my God, 19? Tell us a few details about it.
Shockingly, this patient was a young male. He was a vegetarian,
Oh my God, okay.
non-smoker, and non-alcoholic,
Okay.
but had a family history of some
So
cardiovascular
that
disease.
strong is the importance
and
of
stress.
a family history. Achha.
He had a lot of job stress. So luckily he could be salvaged, but the age was shocking. That's the reason I'm saying never ignore symptoms in the young person.
So when you say this young heart attacks, right? A little, difficult question, but what kind of socioeconomic classes are we seeing here?
There is no specific socioeconomic class, I would feel, which is more predominant than the other. It again relates to the lifestyle which they are leading more than anything. I do not feel there's any socioeconomic aspect to this.
Okay. Silent killer in the young.
Smoking and stress.
Okay. Caffeine overdose in one word.
Well, jumping coffee bean,
Okay.
because if you have caffeine overdose,
Yeah.
you can have a person who's very, very restless, very,
Yes.
very disoriented,
Yes.
who's continually moving around, does not sleep, is very aggressive. Very typical to the coffee beans which pop out of your machine, I would suppose.
Yes. Okay. Life lesson that you learned in ICU.
Life lesson is to live life to the fullest. Enjoy your life, live life responsibly. You do not know when it may end and at what age it may end. So every moment you have is precious. Learn to value that moment and learn to accept things and move on. I think live life to the fullest and enjoy each
That's
and
the
every
message
moment.
that
That's the message.
Sure. So help us, share a case with us which is very close to your heart, which has motivated you.
Okay.
And
Since you, very, very good point, and it's an interesting, I'm going to tell you a slight story on this.
sure.
This was a young boy. He came to me when he was around 20-year-old. So he was shifted to the hospital in a completely unconscious and comatose stage from an outside hospital.
Acha.
Unfortunately, he had suffered an accident. And after that accident, he had injured his brain. So he was completely unconscious. He was on the ventilator. He had fractured ribs on both sides, for which both sided tubes were put in and ICDs were put in. He had
Okay.
multiple fracture bones. So the fractured clavicle, his spine was blown out, fractured at multiple places, and he was not moving hands or legs. They shifted him to the setup saying that he's not going to survive. Don't even bother to do anything. So this particular patient went through large amount of surgeries. Despite being unconscious, we felt that best effort should be made. His spine was repaired. We put in a spine fixator for him
Acha.
and repaired his spine. He was in ICU for nearly 6 months. After 6 months, he went home. He was still bedridden when he went home. After he went home, his rehabilitation process continued for nearly 2 years. He has now completed his graduation. He writes sports blogs sometimes. He has acted in a Tamil film as a guest role.
Arey wah.
He has joined the postal services now as an employee. And last week back, he had an interview done on a TV channel which showed how well he has recovered. So
Wow.
That's
the story from a deathbed to
So-
a successful life, I
yes, so
think.
it's absolutely unbelievable with his
Yeah.
family. 6 months of struggle, all of them, the whole ICU team being with them, and from a person who was given up to die to a person who's now into some activity and
Doing so much in life.
Yes, and he never forgets to call up, and he never forgets to thank the whole team for whatever they've done.
So that's the adrenaline rush you're
That's
talking
true.
about.
That's true.
So that's a beautiful thing to hear, sir. We wish you all the best for all the future endeavors, saving more thousands and thousands of lives who need you. Thank you once again for coming on this
Thank you,
podcast.
Tushita. That's very nice of you. And warm regards. Stay safe, everybody. Stay well.
Thank you, sir. Thank you so much.